After 80, the digestive system often undergoes changes that can affect appetite, nutrient absorption, and overall health. Many seniors notice shifts in how their body processes food, which may lead to weight loss, deficiencies, or digestive discomfort. These changes are subtle at first but become more significant with age. One of the primary factors is a slower digestive process. As the muscles in the gastrointestinal tract weaken, food moves more slowly through the system. This can cause constipation, bloating, or discomfort. Additionally, reduced production of stomach acid makes it harder to break down food and absorb certain nutrients, particularly vitamin B12, calcium, and iron. Over time, deficiencies in these nutrients can lead to fatigue, bone weakness, or even memory problems. Appetite changes are also common. Many seniors experience a decreased sense of taste and smell, which can make food less appealing and reduce the desire to eat. Some may unintentionally eat less, leading to malnutrition. On the other hand, certain medications, dental issues, or chronic illnesses can also interfere with appetite and digestion. Another important change involves the body's ability to absorb nutrients efficiently. Even if seniors eat a balanced diet, their intestines may not take in as many vitamins and minerals as before. This reduced absorption is one reason why older adults are more prone to deficiencies, even when they maintain healthy eating habits. Fortunately, these digestive challenges can be managed with mindful habits. Eating smaller, more frequent meals helps the digestive system handle food more easily. A diet rich in fiber from fruits, vegetables, and whole grains supports healthy bowel movements and prevents constipation. Staying well hydrated is equally important, as dehydration often contributes to digestive problems in seniors. Protein intake becomes especially critical after 80, since it supports both muscle maintenance and immune function. Seniors should also include nutrient-dense foods, such as leafy greens, eggs, yogurt, beans, and fish, to provide essential vitamins and minerals. In some cases, doctors may recommend supplements for vitamin B12, vitamin D, or calcium to fill in nutritional gaps. Regular physical activity, even light walking, stimulates digestion and helps prevent sluggish bowel function. Medical checkups are also important to monitor for conditions like acid reflux, ulcers, or diverticulosis, which can become more common in advanced age. In summary, changes in digestion, appetite, and nutrient absorption are natural after 80, but they don't have to compromise health. With balanced nutrition, hydration, gentle exercise, and proper medical guidance, seniors can maintain strong digestive health and ensure their bodies continue to receive the nourishment needed for vitality and independence. After the age of 80, many seniors notice a decline in their sensory abilities, vision, hearing, taste, and smell. While these changes are natural parts of aging, they can greatly affect quality of life, independence, and even safety if not managed carefully. Vision often becomes less sharp due to age-related conditions like cataracts, glaucoma, or macular degeneration. Even without serious disease, the eye's lens becomes less flexible, making it harder to focus, while the pupils react more slowly to light changes. This is why older adults may struggle with reading fine print, seeing in low light, or adjusting to glare when driving at night. Vision decline not only affects daily tasks but can also increase the risk of falls or accidents around the home. Hearing loss, or presbycusis, is also common after 80. This type of hearing decline usually affects higher-pitched sounds first, making it difficult to hear conversations in noisy environments. Seniors may find themselves asking others to repeat things or turning up the TV volume. Left unaddressed, hearing loss can lead to social withdrawal, feelings of isolation, and even faster cognitive decline since the brain has to work harder to process unclear sounds. Taste and smell also change with age, often becoming less sensitive. Taste buds gradually decline in number and responsiveness, while the olfactory nerves that detect smell weaken. This can make food seem bland or unappealing, leading some seniors to lose interest in eating or to overuse salt and sugar to add flavor. Reduced sense of smell can also be dangerous. Seniors may not notice spoiled food, gas leaks, or smoke as quickly, raising safety concerns. While these sensory changes are common, there are effective ways to cope with them. For vision, regular eye exams, proper lighting at home, and corrective lenses can help manage difficulties. In some cases, surgery, such as for cataracts, can restore vision significantly. For hearing, hearing aids and assistive devices can greatly improve communication and reduce feelings of isolation. Maintaining good oral health, staying hydrated, and using herbs and spices in cooking can enhance taste and smell. Seniors should also be mindful about safety, such as installing smoke detectors and labeling foods clearly in the kitchen. In summary, declining senses after 80 can pose challenges, but with proper medical care, assistive tools, and lifestyle adjustments, seniors can adapt and maintain their independence. Protecting sensory health not only improves safety but also helps preserve the joys of everyday life, like sharing a conversation, enjoying a meal, or simply appreciating the world around them. By the age of 80, the immune system, our body's natural defense against illness, becomes noticeably weaker, a process known as immunosenescence. This age-related decline makes it harder for the body to fight off infections, recover from illness, or heal after injuries and surgeries. Seniors often notice that colds or the flu last longer than they used to, cuts or bruises take more time to heal, and common illnesses may become more serious. One reason for this change is that the production of new immune cells slows down with age. The bone marrow and thymus, which generate vital immune cells, become less efficient, leaving the body with fewer fresh defenders against viruses and bacteria. At the same time, existing immune cells don't respond as quickly or as strongly to threats. This means the body takes longer to recognize infections and mount a defense. Another factor is that inflammation tends to increase with age, a condition sometimes called inflammaging. While inflammation is part of the body's healing response, chronic low-level inflammation can actually weaken immunity further, making seniors more vulnerable to diseases and slowing down recovery. Combined with reduced circulation, which delivers fewer nutrients and less oxygen to wounds, this is why healing after surgery, injuries, or even minor skin cuts takes longer after 80. A weaker immune system also makes vaccines less effective in older adults. While vaccinations are still highly recommended and helpful, the immune response they trigger may not be as strong as in younger people. This is why older adults are often advised to get higher-dose flu vaccines or specific boosters designed for their age group. Despite these challenges, there are many ways to strengthen immune health in later years. A balanced diet rich in vitamins and minerals, especially vitamin C, vitamin D, zinc, and protein, provides the building blocks for immune cells and tissue repair. Regular physical activity, even gentle exercises like walking or stretching, boosts circulation and helps the immune system stay active. Adequate sleep is equally important, as rest is when the body repairs and regenerates immune cells. Good hygiene, stress management, and avoiding smoking or excessive alcohol also protect immune function. Seniors should stay up to date on vaccines such as flu, pneumonia, shingles, and COVID-19 to reduce risks. In short, while the immune system naturally weakens after 80, healthy habits, preventive care, and mindful living can help the body stay resilient. By taking proactive steps, seniors can reduce illness risks, heal more efficiently, and continue to enjoy an active, fulfilling life. One of the most noticeable changes after 80 is the gradual shift in brain function. Just as the body slows down, the brain also undergoes age-related changes that affect memory, focus, and processing speed. Seniors may find that it takes longer to recall names, dates, or everyday words, or they may misplace items more often. This kind of forgetfulness is usually part of normal aging and is very different from severe conditions like dementia or Alzheimer's disease. Still, it can feel frustrating and sometimes worrying. Cognitive slowdown happens for several reasons. The brain's volume naturally shrinks with age, especially in areas involved in memory and learning, such as the hippocampus. Blood flow to the brain may also decrease due to changes in circulation, reducing the supply of oxygen and nutrients needed for sharp thinking. At the same time, the brain's chemical messengers, known as neurotransmitters, decline, slowing down communication between brain cells. Together, these changes can make multitasking harder, slow reaction times, and affect the ability to learn new information quickly. Another challenge is that sleep quality often decreases with age, and poor sleep further affects memory and concentration. Additionally, chronic conditions like high blood pressure, diabetes, or heart disease can have an impact on brain health. Medications, too, sometimes cause side effects such as drowsiness or confusion, which may worsen cognitive function. Despite these challenges, the brain is remarkably adaptable, even in later years. Scientists call this neuroplasticity, the brain's ability to reorganize itself and form new connections. Seniors who actively stimulate their minds can slow cognitive decline and even sharpen their skills. Activities such as reading, puzzles, playing music, or learning a new language help keep the brain engaged. Social interaction is equally powerful, as meaningful conversations and relationships stimulate memory and emotional well-being. Lifestyle plays a huge role in protecting memory. Regular exercise boosts blood flow to the brain, while a balanced diet rich in omega-3 fatty acids, fruits, vegetables, and whole grains provides nutrients that support cognitive health. Staying hydrated and limiting alcohol also make a big difference. Additionally, mindfulness practices like meditation or deep breathing can reduce stress, which often clouds thinking. In short, while cognitive slowdown and memory challenges are common after 80, they are not the end of mental vitality. With proper care, mental stimulation, and healthy habits, seniors can maintain clarity, creativity, and joy in their golden years. Aging may slow the mind, but it doesn't stop it from growing, learning, and adapting. By the time a person reaches 80, the lungs and respiratory system often show clear signs of aging. Just like muscles and bones, the lungs lose some of their strength and flexibility over time. The air sacs in the lungs, alveoli, which are responsible for oxygen exchange, may lose their elasticity, making it harder for the lungs to expand and contract fully. Additionally, the diaphragm and chest wall muscles, key players in breathing, become weaker. Together, these changes reduce lung capacity, meaning less oxygen enters the bloodstream with each breath. This decline in breathing efficiency often shows up as shortness of breath during activity, reduced stamina, or a feeling of fatigue even after light exertion. Many seniors also notice that they can't take deep breaths as easily as before, and recovery after exercise or illness takes longer. Because the lungs play such a vital role in supplying oxygen to every organ, reduced capacity can affect energy levels, cognitive sharpness, and overall well-being. Another factor is the gradual weakening of the immune defenses in the respiratory system. Tiny hair-like structures called cilia, which help clear mucus and debris from the airways, become less effective with age. This makes older adults more vulnerable to infections such as pneumonia or bronchitis. In fact, respiratory infections are among the leading health concerns for seniors over 80, often requiring hospitalization. Pre-existing conditions like chronic obstructive pulmonary disease, COPD, asthma, or a history of smoking can further worsen lung function. Even seniors without these conditions may notice that climbing stairs or walking briskly feels more difficult than it used to, largely because their lungs cannot process oxygen as efficiently. Despite these age-related changes, there are ways to protect and even improve lung function. Staying physically active is one of the most powerful tools. Gentle aerobic activities such as walking, swimming, or Tai Chi encourage deeper breathing and strengthen the diaphragm. Breathing exercises, like pursed lip breathing or deep belly breathing, also improve oxygen intake and help seniors manage shortness of breath. A healthy lifestyle supports respiratory health too. Avoiding smoking or secondhand smoke, eating antioxidant-rich foods, and staying hydrated all protect lung tissues. Regular vaccinations, like the flu and pneumonia shots, are especially important for preventing respiratory infections in this age group. In summary, reduced lung capacity and breathing efficiency are natural parts of aging, but they don't have to severely limit quality of life. With mindful habits, regular exercise, and preventive care, seniors can keep their lungs healthier, breathe easier, and maintain the energy to enjoy their daily activities well into their 80s. After the age of 80, the heart and circulatory system experience noticeable changes that can impact overall health and energy levels. The heart, which has been pumping tirelessly for decades, gradually becomes less efficient. The heart muscle may thicken slightly, and the walls of the arteries and veins stiffen over time. As a result, the heart has to work harder to pump blood, and circulation throughout the body slows down. This often leads to common issues such as high blood pressure, irregular heartbeat, or slower recovery after physical activity. One of the most common age-related conditions is arterial stiffening, which raises the risk of hypertension. When blood vessels lose their elasticity, the heart must exert greater force to move blood through them. This extra strain can contribute to fatigue, dizziness, or shortness of breath during even light activity. Additionally, the heart's ability to increase output during stress or exercise diminishes, which is why seniors may notice reduced stamina and endurance compared to earlier in life. Another important change involves blood flow to critical organs. Slower circulation can mean less oxygen and nutrients reaching muscles, the brain, and other tissues. This may cause seniors to feel tired more often or experience swelling in the feet and ankles due to fluid buildup. It can also contribute to slower wound healing, since oxygen-rich blood is vital for tissue repair. Heart rhythm changes, such as atrial fibrillation, become more common after 80. These irregular heartbeats can sometimes lead to dizziness, weakness, or an increased risk of stroke. Combined with other age-related conditions like diabetes or high cholesterol, seniors face a higher risk of cardiovascular complications. Despite these challenges, there are many ways to support heart and circulatory health in later years. Regular physical activity, such as walking, gentle stretching, or water aerobics, helps keep the heart strong and improves blood flow. A diet rich in heart-healthy foods, including fruits, vegetables, whole grains, and omega-3 fatty acids, supports vascular function. Limiting salt, processed foods, and unhealthy fats can also reduce strain on the cardiovascular system. Equally important is regular medical care. Routine checkups, blood pressure monitoring, and heart screenings allow doctors to detect problems early and provide appropriate treatment. Medications can help manage conditions like high blood pressure or arrhythmias, significantly lowering risks. In essence, while slower heart function and circulation changes are natural after 80, they do not have to mean a loss of vitality. With mindful habits, preventive care, and safe activity, seniors can protect their heart health, maintain energy, and continue enjoying life with greater confidence. After the age of 80, bones and joints undergo significant changes that can greatly affect mobility and independence. Bones become more fragile due to a natural loss of bone density, a condition commonly referred to as osteoporosis. With aging, the body's ability to rebuild bone tissue slows down, while bone breakdown continues at a steady pace. This imbalance leads to weaker bones that are more prone to fractures, even from minor falls or bumps. Hip fractures, in particular, are a serious concern for seniors over 80, often resulting in long hospital stays, rehabilitation, and sometimes permanent loss of mobility. In addition to bone fragility, joints also experience age-related wear and tear. The cartilage that cushions joints tends to thin out, while the production of synovial fluid, which keeps joints lubricated, decreases. This combination leads to stiffness, reduced flexibility, and sometimes pain during movement. Arthritis, especially osteoarthritis, becomes more common in this stage of life, making activities like walking, bending, or even gripping objects more difficult. These changes not only affect physical comfort but can also discourage seniors from staying active, which further worsens bone and joint health. Lifestyle factors play a major role in how severely bones and joints are affected. Lack of exercise, poor diet, smoking, and inadequate calcium or vitamin D intake earlier in life can accelerate bone loss. By the time someone reaches their 80s, these effects become more noticeable and harder to reverse. Women, in particular, are at greater risk due to hormonal changes after menopause that speed up bone density loss. Fortunately, steps can be taken to protect bones and joints, even in the later years. Weight-bearing exercises such as walking, light strength training, or even simple chair exercises can help maintain bone strength and keep joints flexible. A diet rich in calcium, from dairy, leafy greens, or fortified foods, and vitamin D, from sunlight or supplements, is essential for supporting bone health. Additionally, maintaining a healthy weight reduces extra stress on joints, making movement easier and less painful. Equally important is fall prevention. Since fragile bones are more likely to break, creating a safe living environment, removing tripping hazards, using handrails, and ensuring good lighting, can dramatically lower risks. Seniors should also have regular bone density screenings and consult healthcare providers about medications that may help slow bone loss. In short, while increased bone fragility and joint stiffness are natural parts of aging, proactive care can preserve mobility, reduce pain, and protect independence, allowing seniors to continue enjoying an active, fulfilling life well into their 80s and beyond. One of the most overlooked but incredibly powerful methods to maintain independence in old age is creating and following a purposeful daily routine. While physical health and external support systems are essential, the structure of your day can have just as much impact on your overall well-being. A clear routine provides direction, reduces stress, and keeps both body and mind active, all of which are key to avoiding premature reliance on a nursing home. A purposeful routine begins with consistency in basic activities. Waking up at the same time each morning, eating balanced meals at regular intervals, and setting aside time for rest helps regulate the body's natural rhythms. These habits not only support physical health but also create a sense of stability and control, which becomes increasingly valuable with age. Adding meaningful activities to the day ensures that life feels engaging rather than monotonous. For example, starting the morning with light exercise such as stretching, walking, or yoga boosts energy and sets a positive tone. Midday might include hobbies like gardening, painting, or reading, while evenings can be devoted to social calls, journaling, or quiet reflection. Each activity adds structure and purpose, preventing feelings of boredom or aimlessness. A good routine also includes mental and spiritual nourishment. Many seniors find fulfillment in prayer, meditation, or practicing gratitude. Others enjoy learning, whether it's through reading, puzzles, or online courses, which keeps the brain sharp and combats cognitive decline. The key is to incorporate activities that bring joy and meaning, not just obligation. Equally important is leaving room for flexibility. A routine should guide your day, not restrict it. Allowing space for spontaneity, like an impromptu visit with a friend or a new hobby, keeps life exciting while still offering a sense of order. Perhaps the greatest benefit of a purposeful routine is the sense of identity and independence it fosters. Instead of being passively cared for, you remain an active participant in your own life. A routine ensures you are not simply passing time but living with intention, which is a powerful motivator to stay healthy and self-sufficient. In short, a daily routine becomes the backbone of independence. It creates balance, purpose, and joy, proving that aging can be a fulfilling journey when each day is approached with structure and meaning.